Okay, so
tomorrow's tennis last day. Make sure you call and we send her a little.
I will. All right, Mindy, can I start now?
Start. Hi, Dr.
Brett.
Schillinger.
Hello.
Okay, so tonight we're having our next installment of our physician wellness program, specifically talking about how residents can transition successfully into the real world and real practice. Just want to let everybody know this is a recorded event, so hopefully we'll be able to see this for those of you who have missed it. So tonight we're going to introduce Dr. Abbey Strauss. He's in private practice. He's a psychiatrist. He's been doing this for over 40 years, even though he looks much younger. And he has a master's degree and also a psychiatric social work degree as well as his MD. He does forensic psychiatry. He also is an advocate for psychiatrists and patients, and he's worked in numerous mental health and other types of advocacy groups. And he's also hosts the podcast for the Palm Beach County Medical Society. They're excellent podcasts, so you really should try to find them on the website. And it's under the Expert Speak. So that's all I have to say. And Dr. Strauss, you have the.
Thank you. Mindy, oh, there we go. Thank you. Good evening, everybody, and thank you. And I'm glad to have the opportunity to talk to you. We're going to try to make this on the shorter side. We'll open it up as needed to questions at the end, and we want everyone to get home early so they can be with their families if you are celebrating Hanukkah tonight. I want to talk about what it's like to be a physician, somewhat what I've learned over the course of the years that have made it more easy, made it easier for me to do these types of things and to look at it from the psychological perspective of what it's like to go into medicine. So next slide, please. I don't want to just read the slides, but I think it's very necessary to understand that many of the people who go into medicine do treat the chemistry, or if you're going into surgery, or you're just going to deal with the structure of your patients. You may not be looking at what's going on psychologically with them, and every patient has a psychological domain. There's no question about it. The important thing, and what we want to talk about today, is the fact that you also, as the doctor, have a psychological domain. Next slide, please. So what will patients remember? What have I learned over the course of the years? Patients will remember as much as what we do to them as what we say to them. This is important. Patients are very sensitive to the fact that they will answer the questions and not go speak to my nurse or go speak to the other person. They want to hear it from you. If you treat a person, let's go back one slide, sorry. Whoops, we're a little ahead of ourselves. One more there. If you treat a person who has an illness, remember that that is an illness in a person. And we tend to forget that, and it's so obvious, but people very much see themselves as someone, a person with an illness. Very important criteria. You have to ask people about their life behaviors to be sure. How do you eat? How do you exercise? But it's much more meaningful if we instruct them, because as you do that, they are listening to you talk to them at different levels. And that what they will do, guaranteed, is that they will tell others about you, your bedside manner. That was a nice doctor. I could talk to him. I could talk to her. I was listened to. Very critical as we go into looking at what you have to do to prepare yourself to be a physician. Next slide, please. So, furthermore, patients will respect you more if they feel that you will reach out to other members of their community, their health community, because too often doctors are too short, they're too terse, and the patient may think that there's too much arrogance in part of the doctor because they're not interested in the rest of the person's life. That's a flaw, and that will get you into trouble. And it will also make it much more difficult to relate to the patients. Remember, they come to you not to talk to your staff. And that's critical. And we've seen too much of this going on now with physician's assistants. Okay, some physician's assistants are wonderful and absolutely necessary, but they've come to see you, not necessarily the nurse practitioner. One of the things that's also absolutely critical is not to be so serious, to chuckle with them, laugh with them, make a fun, make a joke about something. It makes you an engageable and real person. So this is how you begin the interactions with the patients, and therefore the patients then will learn about you, and then you can grow from your patients, especially when you get frustrated. Next slide, please. One of the things that is necessary is what I've called defining your practice. What do you want to do? There are a lot of internists that practice all sorts of styles of medicine. Family practitioners do this, and there is an absolute time and place for it. There's no question about it. But in a more simplistic term, and because I'm a psychiatrist, I will often say, listen, I don't do surgery. You don't prescribe antidepressants. It seems obvious, but what has happened is that many people think that the antidepressants are too simple and not really a sophisticated treatment modality. Indeed, they are very sophisticated. But many psychiatrists do prescribe psychiatric medications in less complex cases. Like I say, it might work if it's a simple depression, a simple anxiety. But the larger question that has to be asked is, why is there not a referral to a psychiatrist? Is it because of stigma, cost, which is a very real issue, denial, that we don't want to bring up the idea that there's a mental health issue here, or an arrogance that I can do it all? One thing I can guarantee is that you will deeply frustrate yourself and endanger yourself and others if you practice outside of your specialty. It happens a great deal. I tell patients that I do not prescribe a medication that I cannot spell the name of the drug. And I also tell patients that I may understand the concept of certain levels of thyroid dysfunction, of antibiotics, dermatologic creams and the like, but I won't do it because I really don't know what I'm doing. So if you're an internist and you've learned something and you know how to manage diabetes, excellent. Stick to what you know how to do. You will get yourself in trouble. And I have seen many cases where people in court will say, well, doctor, so are you a cardiologist? No, I'm not. So why are you adjusting medicines for arrhythmias? Well, because I know how to do that. And you really don't want to go along that line. You have to define your practice. I'm going to be a cardiologist. I'm going to be a rheumatologist, and I'm going to do the best I can. And I'm going to use the rest of the community to help me practice better medicine, the way that the Mayo Clinic model is. It's very critical. So stick to your decision, stick to what you want to do, and define yourself. I want to be a whatever, and that's fine, but know your limitations. Next slide, please. Okay, so one of the things that always bothered me, and I tell young medical students and even other people who are in associated mental health fields, don't let your specialty be your life. I'm sure we've all seen this. I know people that if you go to a meeting in my area of mental health, they only talk about the latest in bipolar disorder, and this person's that, and that person's depressed. And it's like, is there not anything else in their world? So I encourage them to please take courses, go to meetings where they'll learn something different that has nothing to do with their specialty. It expands their entire world. Spend time with people outside of the medical profession. And I put together this quote a little bit, but it captures what I hear so much. Oh, he's a surgeon, and that's all he talks about. The cases, the nurses, the insurance companies. That's important, sure, but there's got to be more to life than his specialty. It's almost as if his ego needs to define himself with his specialty and nothing else. And that ends up really shortchanging his life. So if you want to be a good neurosurgeon, awesome. We need good neurosurgeons, but do something else in your life. Next slide, next slide, next slide. Let's go back a little bit. Many of you may not know who Maimonides is, but it is a physician who many years ago was a great thinker and a great mover in terms of understanding the role of physicians. If you don't know who Maimonides is, you should read about Maimonides. Now, I've got to figure out how to get rid of it's covering up. Let's see here. How am I going to get rid of that? The picture, so I can read the frame. I can't read it. Oh, well. But this is the prayer for the physician. And it says, if doctors wiser than me seek to help me understand, grant me the desire to learn from them, for the knowledge of healing is boundless. But when fools deride me, give me the fortitude and the love for my profession to strengthen my respect, to understand the derision even of men of higher stations. Illuminate the way for me, for any lack in my knowledge can bring illness and death. A lot of people do not really give thought to the profound effect that a physician has on their patients' lives. We have to be humble about that. And this comes from many hundreds of years ago. This is not new. We have to listen to people. And one of the things that we will get into, next slide, please, is the whole notion of someone who would be your mentor. But if we look at the Maimonides saying, it's called the Maimonides prayer. He is praying for doctors. It is not just in the relationship between myself and the patient. It goes both ways. It makes us think about who we are and why we are doing what we are doing. In order to survive in medicine, regardless of what your specialty is, somewhere along the line, perhaps starting earlier than later in your career, but I can guarantee you that will not stop throughout your career. You have to realize that you have an inner self, and you have to be comfortable with your mistakes, with your fears, and with your accomplishments. And also put this all in the notion of your ego structure. So you know who you are and you are strong. I often ask people, why did you become a physician? What drove you to it? Make a lot of money? Well, yeah, you could. But is there something deeper to it that will carry you through the frustrations? Have you matched the goal? Have you reached the goal? And early on in your career, you may not have that yet. But when you get a little older, it becomes a much more real entity. Has your original goal been detoured by the reality of medical practice? What has medical practice done to your soul? It's very powerful, because the other physicians on here, I know some of them personally, they're all very good people. A lot of time what we talk is about how what we're doing affects us internally as a person, how comfortable we are, how disappointed we are, frustrated, and the like. Does it make us a better person? Does it make us more of an entrepreneurial practitioner? What is the nature of medicine as we practice today? What is it doing to us as people? I also ask patients when they talk to doctors, how did your doctor talk to you when there was a problem? Was he cold? Was he sympathetic? Did he spend some time with you? Or did he simply say, go speak to a psychotherapist, something like that? To the flip side, how has death, your errors, we are all going to make errors, your suffering, the patient's sufferings, the real clinical, I call them roadblocks, that you are encountering as people who are suffering are not able to get better. You went to medical school to make people better. Who has sat down with you to talk about what you do when you can't do that? The other element, very big in our society now, is the inability of your patients to afford the skills that you have, to afford the medicines that you will think should help them. How has this changed you? Made you more cynical, made you more of an advocate, made you more afraid, made you more staid and only going to simply give standard, inexpensive, generic medications? How, if it has changed you? I want you to think about what it has done to you. And of course, most people process these questions better if they have a mentor or someone else to help deal with these feelings and the realities of being a physician. I know that when I was accepted into medical school, people were saying, oh, how wonderful, you're going to have a charmed life, you're going to have money, it's going to be a position in the community. And yeah, some of those are true. But what no one came to tell me is that I was going to now enter a world of watching people suffer and who were reliant on me to figure it out to make them better. And sometimes I couldn't. And that I had to learn to process that within myself. Next slide. So one of the big things that we all have to do, and especially as you begin your career in medicine, don't practice by yourself. Have someone you can work with, have a mentor, discuss failures, discuss successes, ask a spouse or anybody else perhaps for their opinions on how you manage failures or enter into debates. Can you debate? Or is everything the way it has to be? Is everything have to be so absolutely evidence-based medicine that you forget there is a human side to medicine? And then when you begin to think about your process here, use that as a learning tool with the mentor. The other thing is, if you can do it, sometimes it's a bit frightening what comes back, but sometimes it's actually very nice to hear it. Ask people that are not beholden to you. How well do you patiently listen? Oh, this doctor, he listens well. He'll spend extra time, or, oh my God, you get 5 minutes, you're lucky. Where do you see yourself? Because ultimately this defines who you are in the world, with your family, and in the profession. I recommend that people join journal clubs. They don't do that very much anymore. Go get your CMEs through group discussions and not telecourses, because the telecourse is two-dimensional. In a group, you can raise your hand and discuss something, and it goes back and forth, much more vibrant, many more harmonics, and it helps develop you so much better. When you do a telecourse, most of the time, frankly, it's just to get the CME so you can get relicensed, something like that. It's two-dimensional. Do something three-dimensional. A mentor is three-dimensional, and you have to deal with these things. Next slide, please. Okay, so not everybody can do all this. Not everybody can do this alone. And Palm Beach County Medical Society has recognized this for quite a number of years. And recently, we have put together a confidential counseling service that uses local mental health providers to deal with your problems and get you started to think about and maybe explore what, if and as you may ultimately need, is necessary to help you function better. The thing is, don't be ashamed of it. Don't hide it. Do it. The services are confidential. Initially, there are no costs involved, and they do not report. They do not report to the Board of Medicine. If things are particularly bad, we have the PRN, Physicians Resource Network in Florida, which is really quite good. They are very intensive. I've worked with them with a number of patients, physicians, and they really work to do everything they can to make you better and protect your license. So if things get a little bit out of control or beyond what can be done through some of the local counseling services, and you worry about the ramifications, regulatory ramifications, PRN is the place to go. They involve themselves in your life as well, but it's good. One of the things, again, is, and we have to do this throughout life, what are the values that we have in life? What gives me a sense of direction? What gives me a sense of feeling good about myself or embarrasses me? And how do I see myself as a physician? Do I see my physician as someone who simply makes money, part of a clinic, or am I really a healer? And obviously there are overlaps, but who are you? Who are you? And this will give you the strength to go through all the stresses that I can guarantee you will have as you go through your life as a physician. There will be people who will criticize you, chastise you, sue you, everything else possible for a whole bunch of reasons that may or may not have anything to do with your real core skills. And so you have to know that you are strong enough, that you've dealt with difficult cases by speaking to other people, getting help, your mentor, consultations, not being embarrassed to say that maybe you don't know something. And all of this will ultimately define you as a physician and how successful you are in your life doing a very honorable thing. But the thing again, and you'll hear it over and over and over, don't do it alone. If you're not comfortable, if you're having questions about, am I doing right? Am I good? Am I bad? Am I making mistakes? Are patients liking me? Why do, when I go on the internet and I see these rating service, I only get 2 stars instead of 5 stars? You better ask, but don't do it alone. Obviously, don't ask just yourself, I guess is what I should have said. Get a mentor. If you have a psychotherapist, that's good. Talk to somebody, but doing it alone may be one of the reasons psychologically, part of your character makeup as to why the problems exist, because you're not listening to people. You're not getting other people to give you guidance. I remember in medical school, in residency, we had one guy, and he was just arrogant. He thought he knew everything, and he made sure that everybody knew how smart he was. He was smart. But one of the senior attendings walked up to him one day, put his arm around his shoulders, walked him down the hall. And the last thing we heard him, the attending say to the resident was, "Young man, how long have you been a physician?" And he said, "Oh, 2 years. And the attending said, "Well, I've done this for 40 years. We need to talk. You're not doing it right." They gave him a chance. And because he agreed to see someone and get a mentor and talk about his cases a bit more aggressively and openly and honestly, he made a very good physician, but he had to get over some of the notions of how he defined himself as a physician. A lot of psychological issues here, but worthy of thinking. But don't wait. If you begin to have these tensions now, don't let them fester. They could get nasty. It's like an infection that could be cleaned at the beginning with a little hydrogen peroxide, but if you don't do anything about it, you're going to need intravenous antibiotics. You got to do something about it. Next slide. What you need to do as an individual is take some time. Some people call it mindfulness. Other words are just listening to yourself, looking at what you as an individual need to do to be happy. And that notion has to apply to what you will need to do to make your family happy. And the issue is that sometimes things happen in life where you won't be able to be a physician anymore. What backup do you have? What other part of you is there in your core psychological, spiritual, gestalt, and the like to give you a sense of happiness? It's wonderful when you can do what you want to do, such as be a physician, but give some thought to, you need to ponder what life would be if it was different. The other thing is the importance of family. Again, when I was in residency, I wasn't home a lot. There were hours that I was in the hospital, I never got home. But a friend of mine was a pediatrician, and lovely woman, we went through residency together. And her son came up to me and said, my mom, I quoted, I remember this quote, "My mom is a great pediatrician. We have lots of money. She tries to be here, but she is never home. I wish she was a school teacher." And people who don't understand what it takes to be a physician lack that understanding, but there is a price we pay for it. And the price is very often that seen in our families. Many marriages fail because the non-physician family members, and that can be the cousins or the mother-in-laws or whomever, really do not know how much time away from home is mandatory being a physician. It just is. So you have to have a sense of connection with family. And again, if it's not working than a mentor or a psychotherapist to know, why is it that my wife and I are so distant? Or my mother-in-law keeps saying, well, my other son is married to somebody who's always home and it's a whole different life. Are they giving you a put down? I've seen that. So the issue then becomes more direct of, what is it that will make you happy? Where do you make the compromises? And where do the people around you understand the realistic notions of what it's like to be a physician? Next slide. So you have to pick your practice style. Do you want to work in the VA? Do you want to be a hospitalist? Do you want a private practice? You really make a difference in your life and your family's life if you go work at the VA and you go in at 9 a.m. and you leave at 4:30 p.m. and there's rare call and you don't have to worry about billing issues and all this sort of thing. What do you want to do? Do you always need to be available? And if it's too much so, then maybe you do need, as I say here, a personal psychological assessment to see why you have to be always there, always the hero, always the smart one. Or can you just be a very good, solid physician, but again, go in at 9 o'clock and work till 4. And I've often had a bit of an envy to my friends who worked in emergency rooms, despite the fact that their hours are very long, but when they're leaving, they're done. And they don't have to worry about anything else. And they don't get phone calls over the weekend. It's a very hard thing when we instruct people how to be psychotherapists to learn how to not answer calls, or rather, shall I say it this way, to learn how to evaluate whether a call needs to be answered at 9 o'clock at night or not. What you can do accidentally, and in psychiatry, it's called transference, is that you can build a transference where your where your patients see you as the always available healer, and they'll say, oh, he's my friend, he'll talk to me. No, you have to have lines, you have to have fences, you have to pick your practice style. And developing this can vary obviously with the specialty that you go into, but by the same token, a mentor will help you define that so that you can hopefully feel comfortable in all the domains of whatever style of medicine that you choose to practice. One of the things that I have seen is that people will not have a good marriage and they will legitimize their practice as the reason for being away from their family. I can't be with you guys Sunday afternoon. I've got to go do notes or whatever. No, that's not the way to build a sense of self and a commitment to what makes you happy and other people happy. If you are using your career to avoid a family issue, something's very wrong. And again, a good psychotherapist can help you come to end that. You can't live your entire life like that. I can guarantee you something will go very much awry. Next quote, please, next page. So what you need to do, because you're human, is accept that you might have a psychological problem. And it's better in the long run to get it started, to get it fixed rather than let it muddy up your life and your career. The other thing to begin to realize that nothing is permanent. What would you do if you could no longer practice medicine? Have you given any thought to that? What if something changed? What if something changed politically that it would be impossible for you to practice, or in some other domain? Give it some thought, discuss it with a mentor, think about it. Accept that we all need good connections, and these connections sustain us emotionally, and we have to sustain them in return. So if we have a good family, we've got to invest in the family. And if we're not doing it, then we need to speak to a psychotherapist or a mentor as to why. This goes back to the notion that in order to be a better physician, you have to be a better person. Also, think about what you want to do in life. For example, the pathologist, they don't need a bedside manner, but they're critically important to us in the field. But to the rest of us, remember that we are treating a person's body, but in that body is a psychological person. So the person who's treating eczema or some sort of other perhaps deforming rheumatologic issue, arthritis, it doesn't matter what, we have to stop and think for a moment, what would it be for us? What would it be like for us if we were having that same problem as the patient? If we are uncomfortable with that, talk to somebody about it, a mentor. I always tell students that though I'm talking about all the, shall we say, more difficult things, never lose sight of the fact that you have special skills and society has decided to spend the money to train you to treat people, to touch them physically and emotionally in ways that no one else is supposed to do. And to recognize that they laugh, they cry, they need to touch us, and we also need to be touched. So as you go into this wonderful field of healing, don't do it alone. Look at yourself, define what you want to do, get a mentor who can help you and walk you through things so that you can grow and develop your own niche. And the one thing, again, as I said earlier, is that you will never complete this task, never. But that's the beauty of growing. And if you do it successfully or even partially successfully, depending upon what you're doing, because a lot of times we get in situations where our success rate is not what we want it to do. But recognize that people remember us not only for our skills, but for the humanity that we attempt to put into their lives and say that, yes, we are all going through this together. I find this very much now almost a daily conversation with patients when we talk about the effect of the pandemic. I say, yes, you're right. It's hard, it's scary, it's lonely, but we're all doing it together. And people have said to me, that's nice to hear that I'm not as alone as I thought. You, as a physician, need not be alone. Reach out and we will help you. I guarantee you, we will help you. So I didn't want to go on and turn this into a notion of professional psychopathology. Suffice it to say that it is real and that in the medical community, we get approximately 400 suicides a year amongst our professional colleagues. That's a lot. There's a tremendous amount of alcohol and drug use, a tremendous amount of marital discord, and lesser degrees of anxiety, phobias, depressions, and the like. Be who you are, use your skills, ask for help, don't do it alone. And if you have any questions, ask right now. If not, we'll just use all this as a homework assignment and something to think about. So I think that's the last slide. 13 slides, yes, it is. Okay. So where should we go with this?
Well, we have a couple residents here. We have Angelica and we have Jeannie. So would you like to say something?
Hi, everybody. I'll admit I am Jean, and I'm not a resident. I'm actually a lawyer, and I live in Arizona, and I work for Mutual Insurance Company of Arizona. That's a medical professional liability insurer for doctors in Arizona, a few in Utah, a few in Nevada, and some in Colorado. And I work in the risk management services department there, and several months back discovered your website, and so I'm on your email list, and we will be insuring some residents through a new program next year. And in my past life as a litigation attorney, I also defended residents, so this program really interested me. And I have to say that Dr. Strauss, you're a dynamic speaker, and you know, I've just been very moved by the advice that you offered, and it's just excellent. I just think it's excellent advice, and as a lawyer, I wish I could have given it that well to some of the doctors and residents that I represented.
Well, thank you for the compliment, to be sure, and thank you for joining us from Arizona. The Palm Beach County Medical Society is a very dynamic group.
I can tell. I mean, I just with the emails, I can see all the resources that they offer their members, and some of our county societies out here in Arizona could certainly learn from that.
Ms. Varner, what do you think the takeaway, what's the one thing that strikes you today as far as what you heard from Dr. Strauss that you think is a good takeaway message?
Oh, so many excellent points, but I do think it is that you need to take a lot of time to examine who you are and what's important in your overall life in order to be able to face the stresses that are going to come. Believe me, I've seen my clients devastated by, malpractice suits, and that's only one of the stresses that the physicians face these days. And that's what I do at MICA, is give risk management advice to try and help them with their practices as they muddle through all the, administrative and bureaucracy, red tape. And I just finished writing a white paper on, patients in the office who are verbally abusive. And I mean, there's just so many things to face these days. And so I do think that if you can develop that core strength that you can rest on and rely on, that maybe that is one way to overcome and do the best you can in handling all those stresses that the doctors face.
One of the things that I personally feel, to expand on what you have said, is that I don't think that the medical field pays enough attention to this. It's certainly not cost effective, and it eats a lot of time from clinics and the like. But when I was going for my master's in psychiatric social work, it was mandated, keyword mandated, that all of us went into verbal psychotherapy. And the teacher who taught us psychotherapy, at the very first day, she sat down and she said, each one of you is going to sit with me for breakfast, lunch, or supper, and I'm going to get to know you. And the next week, I'm going to tell you who in Manhattan would be the right psychotherapist for you. And again, let me emphasize, mandated. So she did that, and she was right. And then every now and then she would call us over and say, so what are you talking about to Dr. Hartman? And we, there was no HIPAA rules back then. It was just her concern as a really good professor. And she would then say, because see, I see the way you're doing things with your patients, and I'm beginning to get a theme here that maybe you don't realize that it's not good. Now, of course, that's training for psychotherapy with a very strong psychoanalytic flavor. It's a different approach. But then when I started residency back in New York City, we were, again, I used the word mandated, we had a supervisor that was with us for the 4 years we were in training. And we were given long-term patients that we had to follow. And every Friday afternoon, I remember going to my supervisor or my mentor, and we discussed cases, and he would say, this is good and that's bad. And they really took the time to train us to be prepared as much as possible for not the outside world so much, but our inside worlds as we go through this. And I remember the first time when I was a resident that I think he was 29 years old. He died from cardiac failure. And we were allowed, we were allowed to walk the streets of New York at 2 o'clock in the morning with this one particular resident who was having a really hard time. And we stopped, we got rice pudding, we did this and that, but they wanted us to be humans, not just write up the case and go home. Over and over and over, I can give you 1,000 stories. So I would like to see we as the elders, I'm the elder, you guys are not as old as I am, but we the elders insist that we bring this element to our training modalities, because we're not just training mechanics, we're training people, and people have all the things that we talked about. So enough of my history, but that's my prejudice. And I thank the powers that be that I was lucky enough to go to schools that demanded that. So Jeannie, thank you so much for your comments.
Oh, you're welcome. You know, I also think that your point about just basically getting things out, whether you're talking in discussion groups, whether you're joining a journal club, when I was a young attorney, I used to like write the letter that I wanted to write and then throw it out, that old technique. But I think that's a huge part of it as well. Exactly what you're saying is talk to people or write about what you're feeling.
And if someone is having a problem and they have no other resource, call the Palm Beach County Medical Society and get started there. Don't hold it in. You hold things in, they tend to rot. And then you got a real problem.
No, we had a beloved physician who committed suicide several years ago. And when you were going through the talk, I was thinking about him. He was the guy. You call him any day and night. You never were in the hospital, he wasn't there. And what happened is that his marriage was not doing well. And he was in the middle of a malpractice suit. And this guy really is the guy that you would not expect to make mistakes. And to be honest, he didn't. This was a frivolous suit. And, here's a guy that checked labs 3 times because he wouldn't trust, just checking them once. And the sad part about this is that he went to a motel, he took a bunch of pills, he killed himself, and nobody could find him. And that morning that he killed himself, they dropped the suit. But it was an ego thing because he couldn't handle the lawsuit because he knew he did right. He felt very picked on, and he felt like he was being persecuted. And sometimes I guess in this profession you are. And I think that to a certain extent, we kind of have to expect that we have people that just come in with a chip on their shoulders and they're trying to knock you down. And unfortunately, because he didn't have this resilience, or I don't know what we would call this, maybe just, the ego is too big for any criticism. Because I think that we see a lot of that, especially when you're younger. And I don't want to say millennials only, because I think that when I was younger, I probably took criticism a lot less, effectively. But because of that, he just was not set up emotionally to deal with these stressors, and it just knocked him off. And we lost a really good doctor.
We have in mental health, this is my opinion, I'm sure some people would disagree with me, but I'll say it anyway. We tend to, in mental health and in our society, underdiagnose narcissism. And because it's hard to treat, it's very difficult to get people to admit that they are narcissistic. It's very rare that someone will say, oh yes, I'm a narcissist. And they do fall apart under stresses. So good therapists would recognize this and may not even give that diagnosis to the person for a long time and say, I notice every time you're in the hospital and someone says you missed a diagnosis, you fall apart. Whoa, shouldn't you look at that instead of, whoa, I missed something, let's learn, as opposed to crushing the ego. And physicians, well, everybody, but it's the human endeavor to see things and make mistakes and learn from them and not feel that I'm the doctor. My wife is a nurse, And sometimes when she gets angry, she runs she's run different home health agencies and hospices and stuff. When she gets angry, she'll say, "You're one of those MDs." Like, what do you mean? She'll say, "You think you got your Master of Divinity, not medicine." And unfortunately, she's correct. And so one of the things that's happening now in medicine is that we are graduating with our MD degrees and our specialties and all that stuff. It's awesome. But we're now being, in so many ways, equated to physicians' assistants, ARNPs, even pharmacists now in Florida. And the thing is, some of the physicians' assistants and ARNPs, they're fabulous. Thank God we have them. Some of them are great, but it makes you wonder, why am I spending 4 years here, 3 years here, 4 years there? And I could, do the same thing and not need to be a physician. And if you're going into medicine because you have a narcissistic need to show how strong you are, you're going to bump up against a lot of stuff. And that's what we want to avoid, because those are the people who drift into the alcohol use or the whatever it is. And let us help you as you come into this field, develop these things. And if you have a problem, have it. You got it, you got it. I mean, I can imagine Dr. Bach is a rheumatologist. If you see somebody and you say, "Ma'am, I'm very sorry, but you have really nasty rheumatoid arthritis in your hand," and you just say, "And it is what it is, we'll build around it." Because that's what we have to do. If you have a propensity to a psychiatric problem, then we'll build around it. That's all. But it takes time, it takes honesty, and it gets getting rid of the shame and all that other stuff that we've talked about 100 times.
Well, one thing, and I don't know, Brent, you could come in on this too, Martha, is that, I don't think that we're so critical in our training anymore. Like, for example, M&M conference has disappeared. Yes. Because of lawsuits, because they're afraid that somebody's going to sit there in the surgical conference and take notes on how a patient didn't do so well and maybe we could have done better, and then it's going to lead to a lawsuit. And so, a lot of those things are disappearing, and they're kind of mandatory, but they tone it down quite a bit. When I came up, and we're already starting the beginning this generation, but when I came up, we used to call, morning report the Sado-Socratic method, because you bring all your data in and they would beat you up. Your attendings would say, "Look, you did this wrong, you did this, you did that, you could have done this better," and you get a lot of criticism, but in some ways it's good because you have to think about these things versus, "Oh yeah, that was okay," and to a certain extent, attendings stay with the residents now 24/7. They're attending on call in the hospital now with you. So, you don't really have the opportunity to make mistakes, because when you're cutting a little bit here or there, you get that little nod, whereas the third and fourth year residents are operating, by themselves in the OR at 2 a.m. on appendixes and stuff, because they're not allowed to call their attendings at night. And so you lose that lack of independence and that criticism that we don't get. And I think that kind of fosters this false sense of superiority, or false sense of, I can fix stuff. And, maybe because I'm a rheumatologist, I know there's a lot of stuff I can't fix. And I just have to tell people, we're going to make this better as best I can, but we're going to get you 60% better. Don't expect anything more than that. We always go through that expectations before we start, because I don't want them to think that, that we can't do stuff. But this lack of criticism, may be part of our problem, because we're too afraid to say stuff. And now in this politically correct world, we're definitely afraid to say something because we don't offend somebody for some reason.
I would tend to agree that the training has moved in that direction, where a lot of the educational institutions are afraid of getting sued. So they back off. They're much easier on the students, but then that's that much more challenging when you end up in the real world, where it's not such a kind environment, as we've referred to multiple times here. But I also wanted to say thank you, Abbey. Some wonderful advice, wonderful tips.
Thank you.
And the historical perspective is great. The reference to Maimonides, you know, and I think what that tells us is these issues are nothing new. You know, Maimonides is what, from the 12th century. And it wasn't new when he was talking about these things, you know, particularly about treating the patient as a patient, not treating their illness, and the respect that we need for the patients that they need for us. I mean, these discussions have been going on for years. They're going to continue to go on, but the more we talk about it, I think it's a much better place that physicians can be in and that patients can be in as well.
I agree with both of you. As you were talking, I remembered the first time that when I was fourth year, Beth Israel in New York, and I was chief resident, and I walked on First Avenue and said, oh my goodness, I'm the chief resident for a 1,000-bed hospital. I don't know what I'm doing. And Henry Pinsker, who was one of our attendings, said to us as we would be prepared for that, he says, you know a lot more than you did because of the way we trained you. And I didn't understand what he really meant. But now I look back and I say, Dr. Pinsker, thank you. They were not gentle on us. And again, I say thank you to them, very much so.
The residents just did this unit on imposter syndrome, you know, similar to, you know, getting out there and, you know, feeling like you're supposed to know something when you're like feeling very shaky.
Mm-hmm. Yes. And I mean, I don't want the three of us to sit here and swap stories of how we learned or didn't learn, but again, I'm not in residency programs right now, so I'm not quite sure how far I can extend this. But, oh, let me just say it this way. They weren't gentle. They weren't gentle. And more than once, I would talk to my wife and say, you know, I think it's another career time. I think this is incredible. But now we need to do that to the young ones now. We need to do it. You know? So.
Well, this has been great. I think that I learned a lot. And I think that this has been very helpful. So if you had to summarize anything, Abby, what would you say?
I would quote Maimonides' phrase, find a mentor, be true to yourself. I don't know if Maimonides is saying that. Be honest with yourself. You are a human being just like your patients, and work at making yourself better, but don't do it alone. You'll fail. You'll fail. And again, if you have questions, ask. That's what we're here for. It's, you know, it's so simple in some respects, but we live in a society that has drifted away from that. So with that, we let everybody go home, I guess, and have a pleasant dinner and stay safe and enjoy the cold if you're here. I don't know what the temperature's like in Arizona, but it's chilly for Florida.
You know, it's pretty cold for us. We're about 60 degrees right now.
Okay.
Happy Hanukkah for those of you celebrating.
Absolutely.
Happy Hanukkah.
You too.